So, hi and good evening, everyone. Today we will continue our 11 discussion, second last discussion for this subject, which is we will continue to discuss about national heroes in service provider categories. So, the pair can start first.
Okay. Hello and good day, everyone. Today we're discussing someone who has made a significant impact in the service provider category in Malaysia. Datuk Sri Dr. Michael Jayakumar, a highly respected figure in the field of education and community service. Dr. Jayakumar is widely recognized for his pioneering work in developing educational initiatives that aim to uplift undeserved communities. He is the founder of the Sri Sampurna Group, an organization that focuses on providing affordable education, professional training, and community development programs throughout Malaysia. Through his work, Dr. Jayakumar has championed the cause of making quality education accessible to all, regardless of socio-economic background. His initiatives have helped thousands of underprivileged children gain access to educational opportunities that would otherwise be out of their reach. He has focused on creating vocational training programs that prepare young Malaysians for the workforce, enabling them to build better futures. In addition to his work in education, Dr. Jayakumar has been an advocate for social justice, particularly in improving the livelihoods of marginalized communities. His efforts have been recognized not only in Malaysia but internationally, where his model of service-driven education is regarded as an example of effective social entrepreneurship. I'll pass it to Raz to continue.
Okay, so thank you, Irfan. Moreover, he was actually once arrested and detained under the emergency ordinance for his involvement in a peaceful campaign calling for electoral reforms and social justice. His arrest drew widespread criticism both domestically and internationally and highlighted issues of political repression in Malaysia. This later on led to him being an activist and advocate for workers' right, workers' rights. In Parliament, he was known for his principled stances and efforts to highlight issues affecting workers, the environment, and marginalized communities, as Irfan said just now. Dr. Jayakumar also has consistently fought for workers' rights, including fair wages, better working conditions, and the right to unionize. He has campaigned against unjust labor practices and the exploitation of migrant workers in Malaysia. To conclude, Dr. Michael Jayakumar's lifelong dedication to social and economic justice, healthcare reform, and activism has made him a respected figure in Malaysian civil society. His work has left a lasting impact on the lives of many underprivileged Malaysians. That's all from us. Thank you.
Okay, now it's our turn for Kenwet and also Terani. So today we are going to talk about Dr. Hartini Zainuddin. Yeah. So Dr. Hartini Zainuddin, she is a fierce advocate for the rights and welfare of children. We'll wait for the slide.
Sorry.
Okay, it's okay. So this is Dr. Hartini. So she was a fierce advocate for the rights and welfare for children. So her life work has been dedicated to protecting the most vulnerable members of society, children who often has no one else to turn to. So Dr. Hartini is best known as the founder of Yayasan Chowkit, a foundation that provides essential services for at-risk children in Malaysia. Located in the heart of Kuala Lumpur, Yayasan Chowkit offers shelter, education, and healthcare to children who are homeless, abandoned, or living in unsafe environments. These children face unimaginable challenges such as poverty, abuse, neglect, and often lack access to basic rights like education and also safety. So, under Dr. Hartini's leadership, Yayasan Chowkit became a heaven where children can find not only physical safety but also hope and opportunities for a brighter future. Her work doesn't stop at providing immediate assistance. She understands that real change comes from tackling systemic issues. That's why she tirelessly advocates for policy reforms to ensure that every child in Malaysia, regardless of their background or status, has a chance to grow up in a supportive and nurturing environment. So I'll pass the other part to Tarani.
Yeah. Thank you, Conway. Thank you, Kenway. Continuing from there, one of Dr. Hartini's most significant contributions has been her efforts to address the plight of stateless children in Malaysia. Stateless children often have no official documentation, leaving them invisible to the system and unable to access education or healthcare. Dr. Hartini has been a vocal advocate for their rights, raising awareness about their struggles and working to find solutions. Her work has helped bring this issue to the forefront of national and international discussion. What makes Dr. Hartini's story so inspiring is her unwavering compassion and resilience. She has faced numerous challenges and setbacks in her journey, but her commitment to these children has never been wavered. She believes, as we all should, that every child deserves a chance to succeed, to feel loved, and to live a life free from fear. Dr. Hartini's work is a reminder of the power of empathy and action. She has shown us that we don't have to accept injustice as a fact of life. We can fight for a change, we can make a difference. Let us take inspiration from her incredible dedication and look for ways to contribute to the well being of those around us, especially the most vulnerable. That's all from me and Kenwit. Let's move on to the next presentation.
Okay, so today me and I will be continuing the discussion by sharing the incredible contributions of our Malaysian social activist and entrepreneur, Mudira Abdul Hamid. So her work has impacted countless lives through her community service initiatives, especially in the areas of homelessness, poverty alleviation, and empowerment.
Munira Abdul Hamid is best known for founding the Pertiwi Soup Kitchen in 2010, an organization dedicated to serving meals and providing assistance to the homeless and marginalized communities in Kuala Lumpur. What makes her work so inspiring is not just the meals, but the holistic approach she brings to improving lives. She goes beyond providing food, she aims to offer dignity and opportunities to those who need it most.
Pertiwi Soup Kitchen focuses on providing free meals, healthcare services, and essential supplies to those in need. But Munira and her team didn't stop there. They engaged with the homeless to offer counseling, job training, and reintegration programs, helping people rebuild their lives. This truly exemplifies her belief in sustainable solutions to social issues.
Munira's effort also extend to advocacy. She worked hard to raise awareness about the challenges the homeless face, pushing for better government policies and also social services. She's not just addressing the symptoms of homelessness, but advocating for a long-term solution that can break the cycle of poverty.
Her dedication to the community doesn't stop with homelessness. Munira is also passionate about women's empowerment. She believes in giving underprivileged women the skills and resources they need to become financially independent and self sufficient. Through her programs, she's helped countless women gain vocational skills, financial literacy, and even start their own businesses.
She focused on empowering marginalized community is evident in her leadership of several other initiatives. She's been actively involved in disaster relief, environmental conservation, and education, always striving to make a lasting impact in the areas she touches. She's truly a champion for social justice in Malaysia.
One of the reasons Munira's work is so impactful is because of her commitment to volunteerism. Pertiwi Soup Kitchen runs largely on the support of volunteers, and she has inspired countless Malaysians to engage in social work and become part of a movement of compassion and responsibility.
Munira's work has earned her numerous recognition from local and international organizations, but what truly set her apart is her unwavering commitment to social change. Through her efforts, she helped to create a culture of care and community support in Malaysia.
So to sum up, Munira Abdul Hamid's contributions to Malaysian society through Pertiwi Soup Kitchen and her advocacy for women, marginalized communities and the homelessness have had a lasting impact. She is a shining example of how one individual's compassion, vision and leadership can change lives and create a better society for everyone.
Thank you for listening, and we hope Munira's story has inspired you as much as it has inspired us. Let's all remember that even a small acts of kindness can make a huge difference in our community.
So, good evening everyone. For service provider, me and Izzah have choose KPJ Healthcare. KPJ Healthcare Berhad is Malaysia's leading provider of private healthcare service. The company was established in 1981 with the introduction of the first private specialist hospital in Johor. KPJ has since expanded its network to include more than 28 specialist hospitals throughout Malaysia. The company also has 2 hospitals in Indonesia, a share in hospital in Bangkok and a hospital in Bangladesh. Additionally, KPJ has investments in a retirement and aged care resort in Australia, as well as various healthcare facilities in Malaysia. KPJ's competitive advantage lies in its extensive reach and presence in the private healthcare industry, offering a diverse range of medical specialist services. The company is focused on creating sustainable long-term value for its stakeholders and has made significant advancement in integrated technology and digitalized medical technology. KPJ is also involved in healthcare-related industries such as senior living care services and healthcare education. The company's hospitals are recognized by accreditation bodies and it actively engaged in community service through charity clinics. Next, I will pass to Izzah.
Thank you, Nabila, for sharing the introduction and what is KPJ. So next, I will talk about KPJ healthcare contributions, which is they has contributed significantly to the healthcare sector and the community through various impactful initiatives. So first, I will give the example of community healthcare services. KPJ operates Clinic Wakaf Anur, which is also known as K1, clinics and mobile clinics offering affordable healthcare to underprivileged communities in urban and rural areas. So these facilities will focus on essential health services and improving healthcare access for low-income populations. Next, the contributions of KPJ Healthcare in COVID-19. So during the pandemic, KPJ collaborated with Malaysia's Ministry of Health to support public hospitals by managing non-COVID patients, which help free resources for critical COVID-19 cases. So KPJ also actively participated in the National Immunization Program with 22 hospitals serving as vaccination centers. This so these efforts result in over 539,000 vaccine doses administered nationwide. So the next contribution is sustainability and healthcare accessibility. So KPJ emphasizes providing quality healthcare while promoting sustainable. The company integrates eco-friendly practices in operations and prioritize the patient safety and well-being. The last contribution I will share today is education and workforce development. KPJ focus on training and upskilling its staff to ensure high quality healthcare delivery. It collaborates with Ministry of Higher Education to support medical and nursing education through its educational arm. So these initiatives underscore KPJ healthcare role in enhancing community health, responding to public health challenges, and supporting sustainable healthcare delivery. So that's all from us. We will pass to the next presenters.
So I'm going to present about Dr. Jamilah Mahmud, who is highly respected Malaysian physician and humanitarian activist. In her role as service provider, she had made significant contribution, particularly in field of humanitarian aid and public health. As the founder of Mercy Malaysian, Dr. Jamilah established a platform to provide medical relief, sustainable health-related development, and risk reduction activities for vulnerable community both in Malaysia and international. Dr. Jamila also played a role in coordinating enhancing global humanitarian response during the United Nations. She was the chief of the humanitarian response branch at UNFPA and later as a chief of the World Humanitarian Summit Secretariat. Dr. Jamila continued to advocate for health equity, sustainability, and resilience as Executive Director Center of Planetary Health. She worked in initiatives that address interconnectedness of human health, environmental health, and planetary well-being. So she has experience and commitment to humanitarian service have made her a prominent figure in improving health and humanitarian outcomes globally. Her work has made her receive respect internationally. That's all from me. Thank you.
We have maybe another 3 minutes to complete this discussion. So what do you guys think?
In my opinion, Dr. Jamilah Mahmud stands out as a global humanitarian icon as the founder of Mercy Malaysia because she saved a lot of people, especially in disaster zones and conflict areas, bringing hope to those in need. Her leadership extends to global roles, including at the International Federation of Red Cross and Red Crescent Society, where she champions resilience and humanitarian action worldwide. What about the others?
I agree with Mia's choice as Dr. Jamila because, like, as she said, like she is able to help people during disaster. One of it that stands out the most for me was the during 2004 Indian Ocean tsunami, where she dedicated to serving humanity, like the way she responds, how when crisis happens and helps humanity, and I respect a lot, and I can see it as like the main reason that she's one of the best out of the candidates that we have listed.
Yeah, I also agree with both of you guys. And she also involved in she stand out in 2003, which is she gives the medical supplies in Iraq. Mm, yeah, I the others.
Yeah, I also agree with you guys. Beyond emergency relief, Dr. Jamila has also played a significant role in shaping Malaysia's healthcare response to global humanitarian needs, as mentioned by Iza as well. So her leadership and commitment to serving the most vulnerable in times of crisis, I think it makes her one of the best heroes in terms of service provider.
Yeah, I agree with you all.
Mm. Okay, so I think we can finish our discussion here. Thank you guys for cooperation.
Take care, everyone.